Taking you live now to our state capitol tonight, where the Assembly is expected to vote on the state budget proposal any minute now. Passed the Senate earlier today. Fox 40's Riley Carroll joining us now live in studio with more. Riley.
Hey, Nikki, that deadline to pass a budget less than 2 hours away now at midnight. Democrats do hold a supermajority in the Assembly, so this is expected to pass, though they are still debating it right now as we speak. The budget agreement reached by Democratic leaders in the Assembly and Senate would reject or delay several of Governor Gavin Newsom's proposed cuts aimed at closing the state's budget shortfall.
I think that our priority as a legislature, and I know also for the governor, is to solve the problems we have in front of us now, and to also think about the problems that are coming in the future.
One of the biggest differences, lawmakers would hold off on planned reductions to Medi-Cal and health care coverage impacting some immigrants, along with proposed cuts to in-home support services.
We are about to pass a budget that seemingly by definition is not balanced. We need as a critical review of programs to assess whether or not they're achieving what they're intended to achieve. Is it sustainable given increasing costs that we're experiencing?
Democrats and the governor have largely pointed to actions out of Washington, saying H.R. 1 is forcing California to make tough decisions.
And we made some responsible decisions as we move forward to ensure that Californians don't feel and bear the brunt of what's already coming to us from the federal government.
But Senator Roger Nilo says H.R. 1 isn't having the kind of impact Democrats are describing.
What has been imposed by H.R. 1 is work or volunteer requirements for able-bodied adults without children. Those are not families. Could be couples, but primarily those are single people, able-bodied without children.
Lawmakers are also expected to take up the so-called Fair Share plan, which would require some of California's largest employers that don't offer health insurance to help pay into Medi-Cal.
54% of the people that are on a public health care system in our state have a full-time job. We are all forced to ask the question, what do we do about that?
But it's going to have to be justified. And I know the larger companies that are targeted with this are very concerned about it. Number one, they offer health insurance to their employees. Number two, and it'll be interesting to see the data and facts that come out if that particular fair share thing is passed.
Now, even if the plan passes tonight, it is not the final state budget. Governor Newsom and the legislature will keep negotiating in the weeks ahead before that final spending plan goes into law right before the new fiscal year on July 1st. Nikki, back to you.
Riley, thank you. Coming up